My name is Robert Bache, Medicare Bob. I own Senior Healthcare Direct, and I help people nationwide with Medicare. In this video, it's FAQ Friday. If you follow us on Facebook or my podcast or YouTube, then you know every Friday I do an FAQ answer, kind of question answer type of deal. And I had a question from Sarah in California, and she asked me, does Medicare cover transportation? And so this is a pretty cool question because there's actually some changes that are happening right now with that. Currently, no, Medicare A and B does not cover transportation. Some Medicare Advantage plans will cover a certain amount of rides per year to take you to the doctor and this and that, or to the hospital or somewhere that's medical. So currently, Medicare does not cover it. Some Advantage plans do, but it's very limited on the scope of what you can use it for. But here's something that's pretty cool and what might happen here in the future. Uber, Lyft, and these companies are pitching to Medicare, CMS, Centers for Medicare and Medicaid Services, that they should be able to provide transportation as part of a Medicare benefit or Medicare Advantage additional benefit. And so not only is Uber and Lyft, it's really an opportunity for them, right? Because if they can get government funding, it's a win-win. They get government funding, they make money. The plans win because it's a service for you. And in theory, you win because you have this service that will be covered under your health plan. So their pitch is, instead of covering a ride from here to there to the doctor or from a doctor's office back home, why not just give Medicare beneficiaries a benefit amount? So say $1,000 a year that the benefit can use towards an Uber or Lyft experience. So they're looking at that, and that's their pitch. And it has some traction because, especially with Advantage plans, they can probably implement it faster because they do get funding for additional benefits. But it's going to be interesting to see what happens over the next couple of years because it is something that really would help. There's a lot of people, you know, if you're 65 to 75, a lot of people are still driving and still very affluent and all over the place. But I have a lot of clients that are 83, 80 to 86 years old. And, you know, for them to go to a doctor visit, it can be challenging. For them to even go to the bank or go to the grocery store, it's hard to get a ride or they're paying for out of pocket. So transportation being covered as part of a health benefit, to me, is an interesting idea. And I think it could get some traction. On one hand, I like it. I think it's going to give beneficiaries a service and a benefit that they'll actually use. It's good for the health plans because they want to attract people to their plans. It's good for Uber and Lyft. You know, it's going to get them some money. On the other hand, it's an additional benefit, which means the government's going to pay for it. So, you know, Medicare is already going to have some funding issues here down the road. So it's something to keep an eye on in the future. But to answer the question, for now, Medicare does not cover transportation. Some Advantage plans do, but it's very limited. And but the outlook here is kind of up in the air, and we'll kind of see what happens. There is a push right now from Uber in particular that is providing some strong evidence on why transportation should be included in your healthcare. So stay tuned. I'll keep you in the loop. As of right now, it does not cover it, but maybe in the future it will.